those who are 70 years of age and above, those with a chronic health condition, that is to say a long-term health condition, and women who are pregnant. Chronic heart failure, chronic kidney disease, diabetes, neurological conditions such as multiple sclerosis, cerebral palsy, Parkinson's disease, and finally being overweight. We recognise that individuals with a BMI of 40 or above are also considered vulnerable. The first is anybody who has had a solid organ transplant. The second would be anybody with a chronic and severe lung condition. These include all people with cystic fibrosis, people with severe asthma, and those that have severe COPD. These would also be women who are pregnant who have a congenital or an acquired heart condition. That is to say, a heart condition which they were born with, or a heart condition which they have acquired during the course of their pregnancy. This would also include individuals who have rare conditions that weaken their immune system or inbuilt errors of metabolism that make them more susceptible to infection. This would also include individuals who have medication which weakens their immune system to the extent that they are more vulnerable to background infections. These are individuals who have active cancer at this time and are having chemotherapy, individuals with lung cancer who are having radical radiotherapy, anybody with a bone marrow or a blood cancer, individuals who have had a bone marrow or stem cell transplant in the last 6 months, or those individuals who have had a bone marrow or stem cell transplant but are still on immunosuppressive therapy, and finally those individuals who are on immunotherapy, continuing antibody treatment, or any kind of radical cancer therapy which weakens or suppresses the immune system. It's because we recognise that for them the disease course with COVID-19 infection could be more severe than that experienced by the general population. We also unfortunately recognise that those who are extremely vulnerable are at higher risk of requiring hospitalisation due to the seriousness of the disease they can experience with COVID-19 infection.